Akanksha Sharma, and today joining us is founder director of Amandeep Group of Hospitals, Dr. Avtar Singh. He is a distinguished orthopedic surgeon with over 35 years of expertise in the field. For those of you who don't know, Dr. Singh, world's first Punjabi surgeon to perform robotic knee replacement surgery. He also holds the legacy of 5,500 plus robotic assisted knee replacements. Sir, thank you so much for joining us.
It's an honor for me to join Tribune for this podcast.
So, sir, let's start at the very beginning.
Yeah, sure.
Take us back to 1990.
Yeah.
What did day one of Amandeep Hospital with 5 beds look like?
Yeah, it was a small place, just 5 beds or 3 beds, and it was anyhow a cozy place to work with. I started practice in Amritsar because I was born and brought up in Amritsar.
Right.
And then most of my classmates, my class fellows, they moved on to other parts of the country because of the disturbed conditions in the state at that point of time.
Right.
It was, although I could get a lot of opportunities anywhere in the country or somewhere abroad, but then I made up my mind not to leave my city.
Right.
So I started a small clinic, a small nursing home over there in the name of my wife, Dr. Amandeep.
Okay.
And then we moved on.
So, what drew you to bones and joints? I mean, you could have chosen any specialty.
Yeah, that's an interesting question actually. I could have moved on to any other specialty,
Right.
but I was so passionate about orthopedics for a couple of reasons. One reason was that my grandma was she was having severe arthritis in the knee. We were staying in a city called Sultanpur Lodi. At that point of time, my primary education is from there.
Okay.
Because my father used to work as a principal in a school in Sultanpur Lodi, district Kapurthala. So she was finding it very hard to move. So I was just wondering that why can't these old ladies or old people, they move properly? So that just stuck somewhere there. And then during my childhood, there were a lot of excavations going on in that part of the country,
Right.
our city. And they used to make new buildings. They used to dig up the old ones, old structures. And we as students of those institutions, those schools, we were also supposed to work during that excavations.
Right.
So during the excavations, we could find many bones. They belonged to somebody you never know. And I had the habit of gathering those bones, getting them into my home, putting them in a bag and putting them in a room. So I used to store those bones which I could get from the graves.
Right.
So I kept on doing that. I don't know why. I have no reason to explain that. But then after finishing my 10th, then I moved to Amritsar, my parent city.
Okay.
And then I moved on to the medical college. And those bones were still with me.
Didn't your parents and family ever question you?
No, they were like bothered about any other parent. Then what are you doing? You are bringing
Collecting bones.
Yeah. But I was stubborn enough to refuse.
Okay.
So
Amandeep today is synonymous with trauma and orthopedics in North India.
yes.
How have you built that reputation with the patients?
You see, I myself suffered a major accident in 1990.
Okay.
So I had a major fracture, and then I underwent a major operation for my right femur.
Femur.
And those days, there were old technologies. They had to rip apart my entire femur, this much scar, and a lengthy operation, lot of bleeding, and then it took me around 6 months to heal or to walk. So after that, within 6 months, I joined my post-graduation, and that my healing was slow. So that point was always in my mind, that why can't we heal people faster?
Quicker. Right.
And there were technologies available across other countries
But not here.
where we could mobilize people very fast. We could operate upon these long bones through smaller incisions and then mobilize them the same day or the next day. So the moment I finished with my post graduation and my senior residency, then I moved on to a big hospital in Bangalore, Manipal Hospital. There I had the basic training about this. It was called closed interlocking nailing.
Okay.
So I learned the art from there from a senior surgeon, came back, but then I never had the means to buy those machines. That machine was called image intensifier. It's like a live X-ray. So I took a bank loan with some difficulty and then bought those machines. And then after that, there was no looking back actually. We could mobilize these severely injured patients within few days. Just
That's
close
remarkable.
interlocking nailing, move them faster, they will heal very quickly.
Right.
So that was the first game changer, I will say, for setting up the trauma center. So once I was good at these closed nailings, then I thought that we have to go further.
Right.
Going further means you need more people, good people, trained people to work with you, and then you need a good technology, the latest technology. So then I requested Dr. Ravi Mahajan, who was a plastic surgery professor in Robotic Medical College.
Okay.
He was my childhood friend, but then he moved on. So I requested him that your city needs your services. Those days, if you remember, I don't know whether you can recollect, if somebody had amputations
Right.
or crushed injuries, most of the patients, they were going to Ludhiana for replantations. I wanted to do that surgery in my city. So I requested Dr. Mahajan. He immediately accepted my request, resigned from there, from a plum posting, joined me. And then I had to procure that technology called microscope, which was, those days it was costing around, say, 27 lakhs. So I could do that. We bought a very good microscope, and then that was a major leap towards progress.
Right.
We started training patients from all across Jammu Kashmir and from some parts of Haryana and then Rajasthan.
Okay.
Anybody with crush injuries or with the amputated parts, they were brought to our hospital. So by that time we could make a very good team. Couple of plastic surgeons, couple of orthopedic surgeons, they joined hands, and then we moved on.
So you're also known to be extremely passionate about technology.
Yes.
You were the first Punjabi surgeon to start non-invasive treatment for major fractures. You were also the first Punjabi surgeon in the world to bring AI robotics in orthopedics to Punjab. What convinced you that robots belong in the OT?
You see, before I talk about the robotics, there was another very good technology called navigation.
Okay.
I got navigation in 2005, and I was the 5th surgeon in the country to have adopted that technology. Why I adopted that, I'll tell you the thing. When you are replacing the knee joints or the hip joints without these technologies, 80% of your patients will be fine, but 20% of the patients will never be happy, because you cannot correct and analyze the deformity on the table without a technology.
Right.
So you need a tool where you can check yourself. So before the advent of these technologies, the results of knee replacements were not great. When we used to tell our patient that you need a surgery for the knee replacement, they will politely tell us, Dr. Saab, somebody else got it, he is unable to walk. They were also right in their own way.
Right.
But then we had to move on. So we adopted these technologies, the navigation, which worked so well for me for around 13 years. And then came the robotics.
Okay.
So then I gave a serious thought of adopting robotics. So that's why I adopted robotics. And then when I started working with robotics, I started enjoying the outcomes. Earlier on, some of the patients, they used to come back with some kind of pain, some kind of instability. But then after the robotic surgery, I normally now forget what I have done in the morning, how many I have done in the day,
Right.
because most of them, they will be happy patients. Yeah, it has.
That makes a lot of difference. Today, Amandeep is called a robotics hospital.
Yes.
What does that tag mean to you beyond just the machine?
It means a lot to me. Now people are looking at us to be the best hospital in and around the area.
Right.
Because the robotic is one word which is now impregnated in the mindset. Everyone now knows this word, the robotic.
Robotics. Yes.
Now people come and ask, are you doing robotics? So we started the robotics about 7 years ago, and now we have started the robotic surgery for the whole body actually.
Okay.
For the cancer, for the abdomen, for the chest. Most of our major surgeries are now done with the robotics, apart from orthopedics, other specialties as well.
Right.
Yeah.
You recently launched North India's first 3D lab.
Yeah.
Could you please walk us through how a 3D printed model or a patient-specific implant changes the game in complex trauma or deformity surgeries?
Yeah. You see, in the modern era, the technologies are always important, and this is the latest addition to orthopedics, the 3D printing technology. You see, now these days many joint replacements are happening, and then many of them, when they don't heal, they have to get another surgery after that. So multiple surgeries. Once your case goes wrong, you have to undergo multiple surgeries. So in these multiple surgeries, you end up losing the bone. This is the hip bone, bone of a patient who has already undergone 4 surgeries. And look at this bone, how much bone he has lost. This is not a normal bone anymore. And you cannot implant the normal joints which are implanted first time, because this is now 4th surgery.
Yeah.
There is no implant available for these patients. Before the advent of 3D technology, these people were never cured. They were always limping, they were having painful life, and most of them, they were on the bed. So 3D printing has made like life so much easy for them. So what is 3D printing? We take a 3D CT scan of that particular bone, and then we put that 3D CT scan into a printer, and then printer comes out with a model.
Okay.
Like this is a model for a particular patient. This resembles 100% with the original bone of that patient, size wise and shape wise. So this is exact replica of a patient's bone. So then we send this model to an implant manufacturer who manufactures the implant for this particular defect.
Okay.
Like in this patient, this was the implant we got from the manufacturer, and it will fit nicely into this defect. So this is the 3D technology which makes it easy or possible for an orthopedic surgeon to do a replacement in these badly deformed bones.
Right.
So that's a major step forward. And the other advantage of this 3D technology or 3D printing in orthopedics is that if somebody is having deformities, like जिसको टेढ़ी मेढ़ी bone बोलते हैं. So if you have a bone like this, again it's a good case for 3D printing technology. It is very easy to make these bones straight with the help of 3D technology. You take a CT scan, give it to the printer, printer will give you this exact replica of that patient. Then the 3D printing technology will make the cutting zigs. You just put the zig on, make some cuts in the bone, and you will get a straight bone.
Fellow surgeons refer to you for non-union and not healed fractures.
Yeah.
What is your approach when a person comes to you after 2-3 failed surgeries elsewhere?
Yeah, see, non-union is getting very common in not only in this country, in other countries as well,
Mhm.
because number of fractures have gone up,
Right.
and now the fracture surgery is being done in even in smaller hospitals by surgeons who are not adequately trained, I will say. So they will come to a bigger center, and luckily we are one of those centers who get a lot of these referrals. So whenever a patient comes to you with a non-union of the bone, we reassure them that there is a cure for that.
Okay.
And most of them, they are cured with different technologies. One of them is a Russian technology called Lazarov.
Mhm.
And then there are a couple of other technologies like bone morphogenic proteins, revision nailing, revision plating, and bone
Right.
grafting.
Right. You've trained hundreds of surgeons.
Yeah.
What is that one quality you feel an orthopedic surgeon from Amandeep Hospital must have?
The one quality I would like to have them is empathy.
Mhm.
Empathy towards the patient. They should treat all the patients coming to them as their family members,
Yeah.
as their mothers, their fathers, their brothers and sisters. That is one thing which I want that all of them should have it.
Okay. And finally, what is that one message you'd like to give to that young patient who is at the border and feels that good treatment is only for big metros?
It's a myth that good treatment is available in bigger metros. Rather, it's the other way around. When you go to the bigger metros,
Mhm.
there is no empathy between those doctors and somebody coming from such a far off place. You go to your own cities, most of your doctors there, they are like your own family members. They are approachable round the clock.
Yes.
Once you go to a metro, get a surgery done, come back home, it will be very, very difficult to go back
Again,
to
yeah.
those places. So don't think that those good or latest technologies are not available in your cities. They are right there in Amritsar and most of the bigger cities in our state.
Okay. And before we wrap up, sir, we have a quick rapid fire round.
Yeah.
Robotic surgery in one word.
It's like too good to be true.
Okay.
Very, very accurate, precise, and personalized.
Your one go-to advice for healthy joints after 40.
Just keep yourself fit. Don't get overweight.
And last, if not a surgeon, Dr. Avtar Singh would be a
Would have been a sportsman.
wonderful. Thank you so much, sir, for giving us your time. It was a pleasure.